right, welcome back to the Kudlow Report. Now, check this out. The nonpartisan Doctors Patient Medical Association is out with a new poll. 83% of doctors have considered quitting the profession because of Obamacare. Tomorrow, House Republicans are going to try for the 31st time to get this law repealed or get Democrats on the record for approving the new Obama tax. So let's talk. Here now, distinguished House members Peter Welch, House Democrats' Chief Deputy Whip, and Kathy McMorris Rodgers, Vice Chair of the House Republican Conference. Welcome to both of you. Peter Welch, I just want to start with you because this is so incredible. A byproduct of Obamacare, 83% of doctors, they're thinking about quitting because they think they won't get paid under Obamacare. What's your response to that? Not getting paid under Obamacare.
You used the right word, Larry. Incredible. I mean, the American Medical Association supports Obamacare, as you call it. This is kind of a crackpot organization. They're the folks who think that illegal immigrants spread leprosy. They're against vaccinating our kids for things like polio. So this is just a totally bogus report. It serves the interest of folks who want to repeal, as you say, for the 31st time, the health care bill, rather, by the way, than come up with an alternative, something that is going to help folks get access to preventive care.
With all due respect, okay, you're ad hominem the group. Kathy McMorris Rodgers, I want to give you a chance because, Kathy, I've heard many times doctors express so much frustration over the red tape and the fact that they're no longer adequately getting paid for their services, and a bunch of central planners in Obamacare's HHS department are going to run this thing. Do you think that's a crackpot group? Do you think this is a crackpot idea that 80% of the doctors will walk out?
Well, I've talked to enough doctors to know that they are quite concerned, and they recognize that these health care decisions belong in the hands of patients and families and doctors, not by the federal government. And Obamacare, unfortunately, is a big government approach to one of the most personal aspects of our lives, and we need to be protecting that doctor-patient relationship. I've also talked to doctors who, they don't even encourage their own children to go into the health care profession because they don't like the direction that it is taking. We have a doctor shortage in America right now, and yet many are either considering quitting, retiring, or not encouraging others to go into the profession.
But, I agree with Kathy about the hassles that doctors are expressing, but I hear them talk about all the insurance hassles that they get. It's just unbelievable paperwork. A lot of that is required by the insurance companies. The insurance companies like to deny coverage because the more they deny it, the more their profits increase. And by the way, one of the things under the Obama health care bill, insurance companies where they were taking more than 20% of your premium dollar and putting it into their pockets rather than our health care, they had to give that back, and that resulted in lower premiums for the businesses that paid it, for the individuals that paid it. So there's a lot of hassles in health care. Kathy's absolutely right about that. But you know what? That's the insurance-based approach that we have that just is incredibly complicated.
I might suggest that it's Medicare and these government programs that are driving a lot of these decisions. It's Medicare reimbursements now that are making it difficult for doctors to pencil out. Try to find a doctor in Eastern Washington and anywhere in America who will take a new patient on Medicare. It's very difficult because the government doesn't reimburse for the actual cost of the service that they have promised under Medicare or Medicaid or under TRICARE. The federal government has made all these promises, but they don't actually reimburse the doctors or health care providers for the actual cost of delivering those services.
A lot of truth in what you say on that. And the question I have is whether we've got to move away from this fee-for-service system, whether it's Medicare, whether it's private pay, and try to go into accountable care organizations where instead of rewarding every service that anybody can think of to do, and you do too many services because that's what's encouraged, you try to reward doctors and hospitals for performance, keeping us healthy.
Well, the proponents of Obamacare, when I heard them many times say that they were proposing a Medicare for all type of approach in America, and we see right now for about 50% of those in America get their health care through one of these government-run health programs. Well, and yet actually Medicare denies more, and these other government programs deny more than the private health insurance companies. Last week I was hearing from many that were saying Medicare is deeming more and more services, health care services as not medically necessary.
I have to leave it there. I'm sorry. We need a longer time. I will just say this. I personally have heard so many doctors complain about Medicare down through the years. A lot of these guys won't even accept Medicare anymore. But we need a longer discussion. Thanks to House members Peter Welch and Kathy McMorris Rodgers. Tomorrow night, the Kudlow Report is going to be live from Washington. We're going to cover this vote to repeal Obamacare.